Alrighty, so now we're going to talk about total fertility rate, which is defined in this meme, but we're going to talk about it more here. So, fertility rates are related to how many children a woman is having. It tends to be higher in developing countries and lower in more developed countries. So, the total fertility rate is the average number of children a woman will have in her lifetime. This is an average, so it's not an exact number. Some women may have more children than that. Some women may have less children than that. So, this is the estimate for the average fertile woman. So, a woman of childbearing age. And then if you have a total fertility rate of 2.1, that is called replacement level fertility, where a couple is having just enough children to replace themselves. And if you're thinking, well, shouldn't that be two? Where's that point one coming from? That point one is like every 10th couple will have three children. Keep in mind, this is an average, so it's not like somebody's out there saying, okay, this couple can have two children, this couple can have two children, this couple can have three children. The reason is unfortunately, some children will die before they reach reproductive age. And so this means that if you have a total fertility rate of two, your population will likely end up declining over time. And so, if you have replacement level fertility, that is where your population stabilizes, it doesn't grow anymore, and that's called zero population growth, which has been thought to be a goal for a lot of countries to reach zero population growth. That way, you're not adding to the population. Though there are some countries that have declining populations, and that has become kind of a factor that the governments have to consider. So, what's going to affect the fertility rates? Well, a lot of it's going to have to do with women, their rights, and their opportunities. So, if they have the opportunity for education, a lot of times, if women have the opportunity to go for higher education beyond high school, college, graduate work, they'll tend to push back the years that they're having children. So, they'll have less children over their lifespan. The degree of urbanization, it tends to be an advantage to have more children when you're working on, say, a farm, because those children, as soon as they're able to, kind of get around on their own, they can start helping out with small chores. But in the city, you have small children, you can't send them out to work and start helping to support the family because of child labor laws. So I've actually noticed this trend in my own family. My aunts and uncles who had most of their kids when they were living in India, where my father's family owned a farm. They tended to have larger families, six, seven, eight kids. But the aunts and uncles who had children here in the United States, where they lived in cities, three kids. Otherwise, it gets too expensive to have more kids. The infant mortality rate in general, with a high infant mortality rate, you're going to have high fertility rate. Why? Because, if you're having children, and you know that half of them may not make it to adulthood, you'll have more children to guarantee more of them will survive to adulthood. Another thing to keep in mind is that in some cultures and countries, children are kind of your retirement plan almost. They will take care of you when you are elderly. And so you might be trying to have enough children to ensure some of them survive long enough to take care of you when you're older. This is especially true in like rural environments. Social and religious beliefs can also affect fertility rates. For example, if there are religious beliefs against contraception, that can increase fertility rates. Um, Women's rights. So, if women have the right to choose whether or not they're having children, that can affect fertility rates as well. Also, if women have the right to, refuse marriage and things like that. Government policies can affect fertility rates. We'll try and do a case study on the one child policy in China and how that affected fertility rates there. And then economic status or poverty. People with higher economic status may have the access to methods of birth control that would allow them to reduce the number of children they're having. Whereas that access to healthcare and methods of birth control may not be available to lower income people in the country. The age at which a woman gets married or the age at which a woman has her first child can also have an impact, because if a woman starts having children at 20, they have about 25, 30 reproductive years. So they could have, five, six children technically, biologically. If a woman doesn't start reproducing until the age of 30, she's got about 20 reproductive years. So she might have less children. And access to healthcare and family planning is also very important. So let's look at fertility rates in 2019. If you'll notice, a lot of countries in the northern hemisphere had reached either replacement level fertility or lower, which would be a little above a hair above 2. Notice that you have countries in Europe, um, South Korea, Japan that have lower than replacement level fertility, and those are countries that worry about a declining population. Then you have other countries where you have the higher total fertility rates. A lot of them tend to be concentrated. So here is Afghanistan, and a lot in sub-Saharan Africa. A lot of factors have led to that. So, for example, increased poverty in Afghanistan. They've been at you know, have war and lots of political turmoil, which leads to increased infant mortality rates. There might be lower rights for women under the Taliban for sure. So women may not have the ability to say, no, I don't want to get married and have children. Um, in some countries in Africa, there have been years of war that increase infant mortality, kind of destabilize the healthcare system, which might decrease access to family planning. Um, you'll notice that China, which had its one child policy. Now, I believe some of them are allowed to have two children, some couples. They have a low fertility rate. India, which has a similarly large population, there are about 1 billion people crammed into that tiny space, um, has not had as much success at reducing its total fertility rate. Um, and if we get a chance, we'll try and do a comparison of the two different governments and how they tried to reduce total fertility rates and why one of those policies was not as successful as the other. So, how have fertility rates been changing over time? Well, you'll see in this graph, the red represents in 1950 to 55 the total fertility rates of various countries. So, for example, China and India were both at about 6 children per woman. Nowadays, you'll see China is less than 2 per woman, and India is at about 2.5. This is a graph up to 2010 is where the data is. And you'll notice that the total fertility rates have just been dropping in most countries as time has passed. Infant mortality, I said I was going to talk about. This is particularly going to influence the total fertility rate. Like I said, if there's more likelihood of children dying before they end up reaching adulthood, then the families will tend to have more children. So, infant mortality rate is the number of children who die before 1 year of age. Some of the factors that affect infant mortality are access to healthcare and nutrition, especially while a mother is pregnant. If she has lower nutrition or less access to healthcare, there's less chances of the child being born healthy and being able to survive. Sanitation, if there's an access to clean drinking water, that can increase the spread of disease, and young children are especially susceptible to these diseases. uh, Hence access to clean drinking water. Sanitation also means making sure there's not trash lying around, if there's good, trash collection and removal services. Immunization is really important. One of the things that helped increase the world's population was the introduction of vaccines, which decreased the infant mortality rate dramatically. And public health measures, such as vaccination, but also just public health measures to make sure that children are healthy and are getting proper nutrition and health care and so on. All right, that is that. We've got a few more lessons on populations after this, and then we're moving on to Unit 4.